Good evening and welcome to Chicago Tonight. I'm Paris Schutz. Brandis Friedman has the evening off. On the show tonight, one-on-one with Chicago's top doctor to discuss the rising positivity rate, indoor dining, and vaccine rollout.
That's a quantum leap from where we were even 3 weeks ago.
Plus, our Spotlight Politics team weighs in on the mayor and governor's concerns about the uptick in COVID-19 and much more.
I want to get things done.
Is it time to abolish the Senate filibuster? We look at the procedure's history and how it could be changed. Could a federal assault weapons ban prevent mass shootings? A new study out of Northwestern makes that case. And a new recent report finds Chicago Police Department has made progress with its consent decree, but not everyone agrees.
The mother of dragons, the Khaleesi of the great grass sea, the unburnt, the breaker of chains.
And do you wish you had an introduction like the Mother of Dragons in Game of Thrones? A local author tells us why she thinks it's important to be your own hype person. But first, some of today's top stories. Another emotional day of testimony in the trial of former Minneapolis police officer Derek Chauvin. Several witnesses became upset on the stand and described feeling helpless as they watched George Floyd die, including the cashier who noticed Floyd had counterfeit money.
We saw you standing there with your hands on your head for a while, correct?
Correct.
What was going through your mind during that time period?
Disbelief and guilt.
Okay. Why guilt?
If I would have just not taken the bill, this could have been avoided.
Chauvin has pleaded not guilty to charges of second-degree unintentional murder of Floyd after kneeling on his neck for more than 9 minutes. The trial is expected to resume tomorrow. Vice President Kamala Harris is set to visit Chicago on Tuesday. It'll be Harris's first time visiting since being sworn in and will be aimed at promoting vaccine equity, which has been among her top priorities since taking office. It's been a thorny issue in Chicago and statewide, with officials working on a variety of fronts to close vaccine equity gaps since COVID-19 has disproportionately affected Black and Latino residents. And Illinois health officials report nearly 2,600 new cases of coronavirus, including 28 additional deaths. The state has now seen more than 1.24 million total cases and 21,301 deaths. So far, nearly 17% of the state's population has been vaccinated. The first pitches at tomorrow's Cubs home opener will honor state and city public officials. The team announces Illinois Public Health Director Dr. Ngozi Ezike and Chicago Public Health Commissioner Dr. Allison Arwady will each throw out a ceremonial first pitch. Tomorrow's 1:20 start against the Pittsburgh Pirates will have limited fans in the stands, with the bleachers section reserved entirely for healthcare workers. And we'll hear about Chicago's rise in COVID cases from Dr. Arwady in just a few minutes. The Chicago Police Department has made progress in its federal consent decree compliance, but it still has more work to do. That's according to a new report from the independent monitoring team that's overseeing the department's consent decree implementation. The report covers the period between March and December of last year. It found that while CPD hit only 19 of 43 reporting deadlines, the department did reach some level of compliance with 154 of the 315 consent decree requirements. WTTW News reporters Heather Sharon and Matt Masterson have been following this, and they join us now with more. Welcome, both of you. Before we talk about the new report, Matt, remind us how this federal consent decree came to be.
Sure. The consent decree itself has been in place for about 2 years now, dating back to March of 2019. It was prompted by the 2014 murder of LaQuan McDonald by Chicago police officer Jason Van Dyke, and a subsequent investigation by the U.S. Department of Justice amid the fallout of the video that came out of that shooting in the case itself. That eventually led to a 2017 lawsuit against the city, which eventually led to the consent decree being implemented.
And this new report is the third of at least 10 semi-annual reports to come from Maggie Hickey, who is the independent monitor, and this will happen over the next 5 years. Let's hear what Mayor Lightfoot had to say about this report's findings.
Even through a pandemic, that the police department made up a lot of unfinished business from the previous 2 reports, and then really focus like a laser beam on making sure that they got a lot of things right, a higher percentage of meeting deadlines, but importantly, making real substantive progress.
So Heather, the mayor is saying that the report gives CPD a good grade for compliance. What are other elected officials saying?
Well, good is relative here because at the last report, the police department basically was missing 80% of the deadlines. Now it's closer to 40 or 50%, depending on how you cut it. Attorney General Kwame Rule, whose office is involved in overseeing the implementation of the consent decree, basically said today that it just wasn't good enough. It might be progress, but there was still real problems with how the city and the police department was working to implement these reforms. And also, the ACLU was not impressed either.
And the mayor kind of barked back at the Attorney General after that statement. Another point of criticism, as you mentioned, has been the department's efforts to expand engagement with communities of color in the city. Let's take a listen.
What the monitor found is that when the city reaches out to those communities, it is very late in the process, often when policies are almost nearly finalized. Instead, what needs to happen is actually sitting down, being open to change, to listen to those communities and their experiences, and to accommodate their needs.
So, Matt, the ACLU is saying they're not very impressed with CPD's effort at engaging communities, even though the report says CPD has upped its game there. What do these community engagement efforts look like?
So the department did do more in this latest reporting period to reach out to communities through things like public surveys on specific department policies and community working groups as well. But there was mixed success on those. And as we just heard, some felt that their comments were coming either too late in the process or they just weren't being heard at all as these policy decisions were being made. And while the department did receive marks for attempting these things and making these outreach efforts during the latest period, the report found that the CPD is still not doing enough and struggling to connect with these community groups that are most impacted by policing.
And Heather, as we mentioned at the top, I mean, this report shows that the department is only meeting about half of its deadlines to comply with this decree. What are the next steps?
Well, we're also waiting for the independent monitoring team to release its report of how the police department handled the summer protests after the death of George Floyd in police custody. We've already seen a report from the Inspector General that was highly critical of how the police department handled those protests and how they responded to the unrest. So it will be a real sort of test of what is going to happen going forward to see what the independent monitoring is, as opposed to just recommend changes like from the Inspector General says about how the police department did.
Yeah, that IG report that you mentioned, Heather, was indeed scathing. All right, well, thank you to Matt and Heather for joining us right now.
Thanks, Paris.
Thanks.
And you can read Heather and Matt's full story on our website. That's at WTTW.com/news. And we'll see Heather again later in the program for Spotlight Politics. More Chicagoans are being vaccinated every day, and it comes at a crucial time. Chicago's positivity rate is on the rise. It's currently at 4.5% compared to 3.3% the week prior. And the daily case average is also up. It's currently a 498 average, where the week prior it was 363 cases. Joining us to talk about this trend and more is Dr. Allison Arwady, the commissioner of the Chicago Department of Public Health. Dr. Arwady, thanks as always for being back. So you heard those numbers about the positivity rate. What exactly is driving this latest surge?
So it is very heavily being driven by younger Chicagoans. We're seeing the 18 to 29-year-olds leading the pack, followed by 30 to 39-year-olds. The good news is that at this point, we've not seen big increases in those in their 70s and their 80s. Some of that is because we've gotten more of those folks vaccinated. But nevertheless, we're seeing this in younger Chicagoans. We're also seeing more COVID cases among white Chicagoans than we had seen previously, and more on the north side. But I want to emphasize we continue to see cases across every bit of Chicago. So everybody remains at risk. And unfortunately, you know, my mood rises and falls a little bit with those numbers, and I am really concerned by the way that they're heading.
And as Dr. Landon told us yesterday, it feels like Groundhog Day. Let's hear what Mayor Lightfoot had to say this week on this subject.
It's not the playing of the sports or being at bars that is causing these outbreaks. It's the risky behavior in those settings that's creating the problem. Not wearing a mask, not social distancing. So, folks, we've got to get back to what we know saves us saves our family, saves people in our network, in our community.
Dr. Arwady, you mentioned young people. Young people like to go to bars and restaurants. We have a map of Chicago's positivity rate with points showing when indoor dining opened back up, and the CDC also released a study saying that there is a correlation between allowing indoor dining and increased cases and deaths. Now, the mayor says she doesn't want to go back on some loosened restrictions on indoor dining, but might she have to?
I certainly hope not, and this is why we're asking everybody to double down. You know, as a reminder, we actually have quite a bit stricter requirements around indoor restaurants, around bars here in Chicago, certainly than are required and that we see across a lot of the state. And then Illinois is also more conservative than we see in a lot of states. My goal is not to have to go back at all, but we're also not in a point where we can further loosen anything, particularly on the indoor side at this time.
And how high do you predict this surge could go, and how long could it last?
Yeah, so we're watching Michigan with concern. Michigan is currently leading the country in terms of cases per capita, and they've always actually been in quite good control among the Midwest states. They've often been leading the pack, and unfortunately, their numbers just continue to go up, and their hospitalizations, including hospitalizations in people in their 40s, are really rising as well. So we've not seen any sign of it slowing yet, and you know, the ask really is, we're not done with COVID. And although we're excited the vaccine is here and making very good progress in terms of vaccinating Chicagoans, now is the time to double down. The weather's good, but you got to wear your mask. And don't think that just because it's spring, we don't have to worry about COVID anymore.
So almost at the finish line, but not quite there yet. And let's talk about vaccination. So Chicago is in 1C of the vaccination phase. How is the supply doing relative to the demand?
Yeah, so we still have a lot more demand than supply. As you know, we really said we're opening wide. We want to get these essential workers in. We want to get everybody with underlying conditions. We hear for next week that we are going to be getting more Johnson & Johnson vaccine in particular than we've received in weeks and weeks. So we're happy about that. Some slight upticks in the Moderna and the Pfizer, but really vaccine supply week after week is the number one thing holding us back. As you know, we're opening 2 mass vaccination sites next week, and we're working to get vaccine out to providers. It's going to keep getting better over April and then especially over May.
And this is happening as you hear dispatches in downstate areas like Quincy where they have a surplus of vaccine. Is there any way to sort of right-size the allocation here so that they're maybe not seeing so much of a surplus and Chicago is not seeing so much of a deficit?
So we've certainly, for weeks, been really encouraging the state to push vaccine to parts of the state that are under-vaccinated compared to some of those downstate areas. You know, everybody just wants to get the state vaccinated. I do think there are lots of opportunities to share some of that vaccine supply, or especially to make sure that some of the surrounding counties to Chicago are getting vaccinated. Because week after week, we do a lot of non-Chicago residents. We're happy to do it, but on the other hand, we know that the demand is really high here. So I'm hoping that the state will make the decision to push additional vaccine up to the Northeast. But I'm glad that we're already starting to see some parts of the state that are seeing some of that slow down, because it gives me hope that here in Chicago, not too long from now, this is going to feel more like a flu vaccination campaign where you can get a vaccine. It's more just making the decision. And we're out of this really, you know, beanie baby phase of I'm trying to get a vaccine. It's coming. I think it's just weeks away.
And not too long from now, 24 hours from now or 48 hours from now, Cubs games at Wrigley Field with limited capacity. Are you worried about that kind of gathering?
So we worked with the Cubs and the White Sox, looked very closely at their plans. Again, like you heard the mayor say, it's not so much the event often, which has a lot of precautions around it, and more about what are people doing in the area. What are the ways that people are celebrating, even the ones not in the ballpark, and asking people to really double down there. That is an outdoor event. We feel much more confident about being able to be open with safety precautions out of doors. It's one of the reasons we're glad to be in spring. But we'll be keeping a close eye on it. I'm really confident in the plans that they have related to that stadium. I would just ask everybody, as baseball's coming, as you know, all the other things that we love about spring are coming, just don't let your guard down as you're being a fan, even if you're not in the stadium.
So not the game itself so much, but worries surround the ancillary activities in Wrigleyville surrounding Cubs games. I have to ask you about Loretto Hospital. The CDPH is doing an investigation with the Loretto board on all those reports of off-site vaccinations that were improper, so-called VIP lists that we reported on at the hospital. What are you finding so far?
So we've been working closely. You know, everybody's goal is to get this right. The saddest thing is that Loretto, you know, has this long history of a good, strong relationship, a lot of trust with the community, and we do want to bring them back as a vaccinating partner, but we have to make sure that there are a lot more safeguards in place because of, unfortunately, some of the decisions that were made in the past. So we are meeting with them. We'll be meeting again later this week once we know a full accounting has been made, and we know that there are safeguards in place to make sure that they are vaccinating their own patients and their own neighborhood. We do hope to bring them back as a vaccinating partner, but that isn't going to be next week.
And as the mayor mentioned, Rush University has picked up some of that slack on the west side for Austin residents, as I understand, because I know a lot of residents are confused about whether there are vaccination sites in their neighborhood now that it's gone away from Loretto. All right, Dr. Arwady, I know you're very busy. Thank you so much for joining us.
Thank you, Paris. Appreciate it.
And I should note that Cubs game is less than 24 hours away, and Chicago Tonight will be there tomorrow with Amanda Vinicky. The word filibuster is cropping up a bunch in political circles these days. A growing number of Democrats see the Senate filibuster as a barrier to accomplishing their legislative goals. Even President Joe Biden, who has resisted calls to end the filibuster, recently suggested he would support it if Republicans blocked his agenda. Meanwhile, Minority Leader Mitch McConnell says ending the filibuster would bring, quote, nuclear winter onto the Senate floor. Joining us to explain what the filibuster is and how it could be changed is Gisela Sin, Associate Professor of Political Science at the University of Illinois. She has a background in legislative rules and procedures. Gisela Sin, thank you so much for joining us. And first, remind us, what exactly is the filibuster?
Hi, Pari. Thanks for inviting me here. So the filibuster, technically, is any action that delays the vote on a piece of legislation. So, and it can be done in different ways, but the most common technique we know about it is the one used by senators who can keep talking to avoid a vote. Now, the second question is, how do we end that delay? And in the Senate, we end the debate through a cloture rule, which is an internal rule of the Senate that needs 60 votes to be successful. So this is something written in the internal rules of the Senate, which are adopted by the senators themselves. And the filibuster is not part of the Constitution, and it has nothing to do with the Founding Fathers' idea of the Senate being this slow-moving body.
So 60 votes are needed for the cloture, although the filibuster has evolved over years to the point where it's been used a lot under Presidents Obama and Trump. They become more common. Let's hear from Senator Ted Cruz in 2013, famously reading Green Eggs and Ham during a filibuster for Obamacare.
Do you like green eggs and ham? I do not like them, Sam I Am. I do not like green eggs and ham. You know, green eggs and ham has some applicability, as curious as it might sound, to the Obamacare debate.
Giselle, we mentioned how it was used sparsely before Obama and Trump, and now it's used all the time to the point where most pieces of legislation pass on a party line or through reconciliation. Why has that been the case?
Well, basically because of the polarization and the division of between the two parties. Filibuster has been able to endure for a long time, and this is because senators have chosen to maintain the filibuster at a time when they had the opportunity to change the rules. So, the filibuster provides individual senators with leverage and bargaining power. So even the threat of a filibuster can get senators some concessions from the opposition, from the House, from the president, and it also increases the visibility of a particular senator or brings an issue to public attention. But it also helps the majority party. McConnell could have gotten rid of the filibuster if he really wanted it, but for majority leaders, because they need to secure 60 votes to end debate, helps them to shift the blame to the minority party for inaction on issues that the majority party as a whole cannot agree on. So, these senators, especially those in the middle, may be concerned sometimes about the future, and sometimes that's why they don't want to change the filibuster.
So there's a political benefit for both the majority and the minority to have the filibuster. As you mentioned, the majority can blame the minority for something not getting done. fans of Frank Capra and Mr. Smith Goes to Washington, Jimmy Stewart, know the filibuster well, because that's the famous scene in that movie where he's talking. And initially, senators had to stay there and talk to keep the filibuster going. Why did that go away?
Well, that change is very interesting. That change around the 60s. And, before the 1960s, the filibuster was a true game of exhaustion. So on one hand, when you had the minority, which was required to hold the floor by continuously speaking. This meant that the speaking senator had to literally stand at his desk and talk constantly without taking any breaks or even moving about in the Senate chamber. But at the same time, the majority had to ensure that they had enough senators on hand to form a quorum at a moment's notice. So if the majority could not form a quorum, then the session would come to a halt and the Senate would adjourn. And the consequence of an adjournment is that the minority would take a break and reinitiate the filibuster in the next legislative day.
So it was a test of wills for both sides.
Exactly. So whoever could last longer won the game. And this was onerous and costly for both sides. And in reality, the senators not only, were unable to engage in other Senate business, but they also, were preventing from campaigning, from fundraising, and their workload was increasing. Their work week had shortened from Tuesday to Thursday. They wanted to go back to their district, and having a filibuster was not convenient for any of them. So it was the cost.
So they both decided to just kind of have this ceremonial filibuster where you just have to notify the parliamentarian and you don't have to stay there and talk. So Biden has expressed openness to reaffirming the talking filibuster. What would that look like in the Senate going forward?
So one way in which this talking filibuster could happen is by requiring the minority, for instance, to be there, 41 members of the minority to be there instead of just the whole majority, just to keep the Senate from adjourning. And this could happen, although it might not. They could change different things. They could, for instance, change the Senate rule, which is Senate Rule 22, but this, of course, can be filibuster. And another way they could do is to change the precedent. And this is the way they have changed the rules or the filibuster before. And this is basically, they establish a new precedent of how they interpret the rule. This is what many people call the nuclear option or reform by ruling, which is basically when a simple majority of senators can establish a new interpretation of a Senate rule. And this is how they change the number of votes needed to end the debate on nominations to the judiciary and the bureaucracy in 2013 under the Democrats. And then in 2017, the Republicans changed the interpretation of the rules regarding Supreme Court justices.
So the filibuster went away for the confirmation of judges in 2013, then Supreme Court justices 2017. And there's been talk about perhaps for a voting rights bill, you get rid of the filibuster or so on and so forth. Fascinating topic. Judge Ellison, thank you very much.
Thank you.
And we're back with more right after this. Still to come on Chicago Tonight, a new study from Northwestern University says a federal assault weapons ban could prevent many mass shootings.
There's no reason why it can't be bipartisan again.
Our Spotlight Politics team on the president's infrastructure plan and officials' concerns about the big uptick in COVID-19 infections. Is making trouble actually a good thing? A local author and self-proclaimed professional troublemaker makes the case. But first, some more of today's top stories. Chicago police are still relying on a, quote, deeply flawed database of gang members. That's according to the city inspector general, and despite a report from the watchdog more than 2 years ago that found the database was full of errors and disproportionately included Black and Latino Chicagoans. The audit says, quote, CPD promised to replace the old system with a new and better one, but has made minimal progress towards this goal and continues to access old gang data. CPD continues to collect and rely upon data that it has acknowledged is seriously flawed. Police Superintendent David Brown blasted the IG's report as incomplete and based on outdated information. We've got much more about this report on our website. State health officials report nearly 2,600 new cases of coronavirus, including 28 additional deaths. Illinois has now seen a total of more than 1.24 million cases and 21,301 deaths. At last count, more than 5.8 million doses of COVID vaccines have been administered statewide. Civil rights leader Reverend Jesse Jackson says the sports and entertainment industries should boycott Georgia over its restrictive new voting law.
Georgia is taking the lead in disenfranchising the black and brown voters. There are other states doing it, but Georgia's taking the lead. We must fight back.
Jackson is calling on Major League Baseball to find a new home for the 2021 All-Star Game, currently set to play in Atlanta, and compared Georgia to apartheid South Africa. Talk of federal gun legislation is front and center again thanks to mass shootings in Atlanta, Georgia and Boulder, Colorado, not to mention Chicago's dismally high homicide rate. One possibility is a revival of a federal assault weapons ban. The last ban expired in 2004, but a new study from Northwestern University says that as many as 30 mass shootings could have been prevented had the ban stayed in place. Joining us now to discuss that study and its implications are Richard Pearson, Executive Director of the Illinois State Rifle Association, and the study's lead author, Lori-Ann Post, Professor of Emergency Medicine and Medical Social Sciences at Northwestern University's Feinberg School of Medicine. Post is also a member of the National Rifle Association. Welcome both of you to Chicago tonight. Professor Post, first, for the purposes of your study and this discussion, define for us exactly what an assault weapon is.
An assault weapon, if you're talking to me, an assault weapon is a gun that is used primarily for combat, or they're created and manufactured for combat. And it means that they have a grip on them, they have a scope. There's a variety of different types of assault weapons. And the primary feature that increases killing is rapid fire. Some have rapid fire ability. And then also they have you can insert a magazine into the assault weapon to increase the lethality.
And I know there gets a little bit of confusion around semi-automatic weapons versus automatic weapons. All right, so your study found that between 94 and 2004, when a ban was in place on assault weapons federally, it prevented 11 mass shootings, and you say would it have stayed in place since 2004, it could have prevented another 30 mass shootings. Explain how you came to those numbers.
So what I did was I looked at the trend line before the imposition of the federal assault weapons ban, which also included a ban on large capacity. I looked at the trend line, and it showed an increase. It was tilting upwards, and then I ran a second trend line during the assault weapons ban while it was in place, and it had a decreasing trend, with the lowest year being the last year of the assault weapons ban. And then after the ban sunsetted, then I ran a third regression line that dramatically increased.
And you were looking specifically at mass shootings. Richard Pearson, your reaction to this study?
Well, there's a lot of things that have changed since 2004.
Yes.
We're looking at kind of an upheaval in society, and I'm sure that's part of it. The other thing is that we look at in Illinois is we have what's called the firearm owner's identification card. And so every person that has one of those in Illinois goes through a background check every night. The only times that doesn't happen are New Year's Day, Easter, 4th of July, Thanksgiving, and Christmas, because the courts aren't open. But so every night I go through a background check, and because I have a concealed carry permit, I go through a second background check every night.
All right, so you're talking about the FOID card. And Richard, I have to mention that your video is frozen, but we can hear your audio. So different regulations in Illinois versus federally. Go ahead.
So in Illinois, gun owners, legal gun owners, go through background checks every night. So if you look at the shootings with so-called assault weapons, or whatever you call them, because they're not really assault weapons. We'll talk about that in a minute. But anyway, there are very few. The problem we have in Illinois is that the certain parts of Illinois has a huge trafficking of drugs of all kinds, and there's large amounts of money that can be made or lost. There's turf wars up there, and around the Chicago area, and so we see these people being arrested, and the police are frustrated because now they arrest them and they immediately let them out. Before, I was involved with looking at one in which a young man was killed by a gang member, and his dad knew who it was and wouldn't even testify because he was afraid to.
So you're saying it's more of a prosecution problem for local prosecutors here than it is a gun problem, although there are a lot of illegal guns that get in the hands of people in Chicago. Lori Ann, back to your study, you focused mostly on mass shootings, not the kind of homicides that typically happen in Chicago. Why did you want to focus just on mass shootings?
Well, because mass shootings generate the most discussion and most media response, even though they make up less than 1% of all death by guns of any type. And so I wanted to focus on mass shootings because it's a specific type of shooting which I define as 4 or more fatalities, not including the perpetrator. And I look at whether or not we could prevent those mass shootings from ever occurring.
And Richard, I'm sorry, go ahead, Lori.
I was just going to say those are a very different type than what Richard is describing there. So they're not in the commission of other crimes. They're not part of drug exchanges or gang killings. There's where somebody specifically goes and premeditates killing as many people as possible in a public area.
So these are different kinds of crimes, Richard, than you were referring to before. And also you're talking about Illinois restrictions. Are there gun control measures that the Illinois State Rifle Association would be willing to support federally, like universal background checks?
But we already have universal background checks in Illinois, so it doesn't matter.
Sure.
What they do to me. I'm in charge of Illinois, but nationwide, that's very unpopular among firearm owners. They really get angry about that, and they feel it's an invasion of privacy. The Congress will, of course, decide that. But I was going to go back to the shooting, for example, the latest one in Colorado. Colorado and Illinois and other places have red flag laws. So if anyone knows of any person who is thinking about committing a crime, the red flag law can be invoked and the police will come out, arrest him, take his firearm, and at some point he will be adjudicated in court as being, a danger or not a danger, but he is out of the picture for a while. And his family knew that this was going to happen, yet they didn't use the tools that were given them. So one of the problems we have is, I and like many other gun owners in Illinois do not want to give up our AR-15, and it's going to be very hard for us to do.
So Richard Pearson mentioned that these kinds of things are very unpopular among gun owners. You are a member of the NRA, as we said at the top. Do you believe rank-and-file NRA members would support something like a national assault weapons ban or further gun safety measures?
I would say that NRA members is a heterogeneous population, and there's not just one type of person. I wanted to learn about gun laws, gun safety, and hence did my training and learned about the NRA that way. But I would just say that I would say a lot of people would support preventing certain individuals from owning assault weapons and large capacity magazines.
All right, we're going to have to leave our discussion there. Our thanks to Richard Pearson and Lori Ann Post. Thanks for joining us.
Thank you.
Thank you. Good night.
The spike in COVID-19 infections is concerning city and state officials as vaccinations ramp up, and the president unveils trillions in spending. We talk about all that and more in our Spotlight Politics tonight, and we're joined, as always, by Amanda Vinicky and Heather Sharon. First up, President Biden unveiled the infrastructure plan today, hoping it will be bipartisan. Take a look.
There's no reason why it can't be bipartisan again. The divisions of the moment shouldn't stop us from doing the right thing for the future. I'm going to bring Republicans into the Oval Office, listen to them, what they have to say, and be open to other ideas.
So Heather Sharon, it's $2.25 trillion plan over about 8 years, about $1 trillion in new taxes by hiking the corporate rate from 21% to 28%. Will it have bipartisan support as the president is hoping?
Well, we heard from Senate Minority Leader Mitch McConnell that he is not inclined to support such a broad package. I also think we're going to also see some pushback on what Biden says constitutes infrastructure. Republicans are saying that it includes a whole bunch of things besides roads and bridges and new bus lines and things like that. So this is really going to be a test of Biden's ability to get things through, not just the House, but also the Senate. And he said that the stakes are incredibly high. He said it will, the fate of this package will determine really whether democracy can provide what people need. So no small task he's laid for himself.
No small task to fix the bridges and roads in Illinois, Amanda. We talked a little bit about it this week. The Eisenhower has problems with traffic. There's so many bridges and viaducts that are crumbling. So what's in this bill for Illinois?
I mean, there will be a ton in this for Illinois if, again, this $2 trillion package does come through. And it's not just, as Heather just was noting, the classic, what you would think of as infrastructure. I mean, this is also dealing with Chicago, of course, has an absurd amount of pipes that have lead in them. This would address that. It would address clean energy, AI, manufacturing, electric vehicles. So it would be more than just putting money into roads as they are now. It would be a transformation of roads in transportation, rail as well. And Chicago, of course, one of the reasons that the city grew so much is because it is a hub for transit. And so this really would mean a lot to Illinois. And by the way, not just to the physical structures, but also the workers. And because part of this, the president has included also a big boost for unions. And of course, this is a very much a labor state and city.
A lot of trade unions, the Road Builders Association waiting with bated breath here. Let's move on to the COVID spike. Mayor Lightfoot sounded the alarm over that COVID spike at a Firehouse news conference today. Take a look.
We have over 400, almost 500 cases on average as of today. That's a quantum leap from where we were even 3 weeks ago. That is concerning, and that is obviously dictating that we have to proceed with caution as we open up. We're not going to see anything more significant in the reopening front until we see those numbers stabilize and start to come down.
So Heather, we had Dr. Arwady earlier in the show. Are these numbers risking a full reopen in the summer?
Absolutely. It is a race against time between cases of COVID, which is being driven by the more transmissible variants, and the vaccination effort. You know, when I spoke yesterday with Dr. Emily Landon of U of C Medicine, she said, look, the vaccine is the tortoise. It's going slow. We know it's going to get across the finish line first, but these COVID variants are the hare, and they are racing ahead. And this is exactly the pattern that we saw in October, where cases started out among the 18 to 39-year-olds, and then it spread to older people, and eventually 25 Chicagoans were dying every day after being diagnosed with COVID-19. So it's really exactly what we saw back in the fall, which was why she said it sounded like felt like she was experiencing Groundhog Day. And that certainly is what it feels like to cover this most recent increase in cases.
And I think in that fable, the tortoise ends up winning at the end of the race. So let's keep our fingers crossed.
Slow and steady wins the race. So there's been a slow and steady vaccination effort, but it has amped up. New vaccination sites, including at Wrigley Field. Amanda, so where is the breaking point here where the level of vaccinations will overtake the rising cases and rates can come down?
Paris, if we only knew the answer to that question, that is what we keep on hearing, particularly from the city officials who say we need more vaccine. We are equipped. We've got now these additional mass vaccination sites. We're equipped to give it when it is enough here. Something that is sort of an interesting political squabble. You also heard Governor J.B. Pritzker today saying hey, I think this city is going too slow with its eligibility rollout, really singling out the city of Chicago for not wanting to go forward with his April 12th date for making any adult eligible, which is sort of an interesting political spat because, by the way, it's not just Chicago that is doing this. While the state has allowed any local health department at this point to go ahead and open up capacity to, again, anybody over the age of 16, you're seeing a lot of health departments not able to do that, particularly those that are in and around the city. And in fact, Cook County, that is, has been even slower than the city of Chicago in expanding its eligibility.
So Pritzker's talking about Chicago not going faster, although Dr. Arwady earlier in the show said state officials need to allocate more vaccines for the state here because we've heard about excess supplies in places like Quincy.
Yeah,
so
you're right.
It's a bit of a blame game here, Heather. Let's move on to Loretto Hospital. The allegations and the reports were fast and furious last week and the week before, and now its CEO is suspended for 2 weeks without pay. The COO quit, of course, and then we hear that State Rep Camille Lilly, who works at Loretto Hospital, she is accused reportedly of having a VIP list. Explain, Heather, where all this is at.
Well, Loretto Hospital was really showcased by the mayor and the Chicago Department of Public Health as a safety net hospital that was serving people that was at greatest risk of severe illness from COVID-19, illness and death. And it has just turned 180 degrees because it's clear that they were vaccinating people who were not eligible, and they were vaccinating people based on their connections to both the CEO and the COO. So there was no doubt that that was a real black mark in Lightfoot's mind, and I think it really caused a great deal of consternation among West Side residents who were struggling to find a vaccine, and many people were just angry that these people were being prioritized over them, even though they were playing the Hunger Games that we've all been playing to try to get a vaccine.
And Amanda, I've asked this before, and since you cover state government, I mean, it's just very intriguing that on the hospital's board, there were 2 state representatives. LaShawn Ford resigned, so now it's just State Senator Kimberly Lightford, and then Camille Lilly, as we mentioned. Are they going to escape any kind of damage from the fallout here?
I mean, thus far, it seems as if they have, from what we gather. The CEO has not lost his position, nor has Lilly for an external affairs officer. She certainly hasn't been out in front of this answering questions. Instead, there's a private company that has been hired to sort of do damage control here. And speaking on her behalf, denying that Representative Lilly had any sort of special list. And so there certainly are, I think, a whole lot of questions, and what this raises is if there is a culture of those at the top being able to do favors for their friends. Where else has that sprung up at Loretto? There's an investigation, so at this point we're going to have to see what turns up, but neither of those legislators have said very much.
All right, a couple reports today somewhat critical of the Chicago Police Department. Heather, you mentioned earlier the consent decree monitor coming out with its report saying the police department's doing a little bit better complying, but then the Inspector General talking about the gang database that CPD has used. Tell us why that has become such a bugaboo for the CPD.
Well, 2 years ago, Inspector General Joe Ferguson said that the way that the city tracked gang members was ripe for abuse, filled with error, and served no clear law enforcement purpose. And the city said, we agree. The police department said, yes, we're going to do better, and we're going to create a new system. Well, that was 2 years ago, and the police department is still using the data contained in that error-filled database, which has included people who were as young as 7 and as old as 100 years old, and disproportionately included Black and Latino Chicagoans. So the follow-up report from the Inspector General's office said clearly that nothing had changed in over 2 years, even though it had become a really high-profile scandal, if you will. And it's not clear whether the police department has a firm plan in place to create a new system, which of course is needed, everybody agrees, but but the devil's in the details as per usual.
And I've interviewed a few folks that were purportedly on that list, and what they told me was it's hard to find jobs, it's hard to find credit, it's hard to sort of get a life going, and what they told me was they were never part of any gang. They were erroneously put on that list, and a lot of people have suggested that they had no business being on that list. However, CPD compiled it. Amanda, late this afternoon we learned of another federal indictment of another former state lawmaker, this one Annazette Collins. Who is she and what's she charged with?
Annazette Collins was a legislator representing the west side of Chicago, so had ties and was endorsed for a long time there until he ended up leaving her Secretary of State, Jesse White. She served in the Illinois House before moving over via appointment to the Senate, and then when she tried to run for that Senate seat, she lost it. So now that's Patricia Van Pelt who took that seat. And at the time, part of that campaign was that Collins had been under scrutiny, and in fact, we know that there had been a subpoena for her involvement in the now defunct General Assembly scholarship program, that she'd been abusing it and misawarding these scholarships to state universities. When she lost that race, she went on this revolving door in Illinois politics to become a lobbyist. And you guessed it, Paris, some of her clients, one of them, Commonwealth Edison. Another one, by the way, was those sweepstakes companies, and that caught up another former member of the Illinois House, Luis Arroyo. So, right, what she was charged with has to do with not filing income taxes properly, personal self and her lobbying business. But I think what it really says is this is a reminder to all of us from the feds, hey, we still have our eye on all of these shenanigans in Illinois politics, and particularly this ComEd situation has not gone away.
ComEd, not a surprise there. They haven't been in the news a lot. Heather Sharon, we heard that the Vice President Kamala Harris is going to be coming to Chicago next week. I believe it would be the first visit by any cabinet official in the Biden administration. What's that visit going to entail?
Well, the vice president is going to speak with Mayor Lightfoot about the city's effort to equitably roll out vaccines and to ensure that Black and Latino Chicagoans basically are first in line for those vaccines, because we have seen those communities suffer greatly during the pandemic. You're right, it's a high-profile visit, and it is it's not a surprise that it would be to Chicago, and it would be showcasing Mayor Lori Lightfoot, who of course endorsed Biden during the primary and was a surrogate for Biden during the general election campaign, and who has said that she was just thrilled to see an African American and Asian American become vice president of the United States. So this is clearly signaling that Chicago's close ties to the White House, which were on a 4-year hiatus, are back in full effect.
We'll see if there's a direct line there to the White House. Okay, Heather Sharon, Amanda Vinicky, thank you so much for joining us as always.
Thank you.
Thanks, Paris.
And up next, Brandis Friedman and lessons from a self-proclaimed professional troublemaker in a conversation that first aired on Sunday's Chicago Tonight Black Voices. But first, we look at the weather.
From jumping out of perfectly good flying airplanes to ziplining through a jungle, Chicago author Lovie Ajayi-Jones has become an expert at challenging your fears. But not all of her daring adventures involve leaving the ground. She was initially afraid to give her own 2017 TED Talk, Get Comfortable with Being Uncomfortable, which is now closing in on 6 million views. She's clearly gotten over that fear, and she's here to help us do the same with her new book, Professional Troublemaker, The Fear Fighter Manual. Joining us now is author, Chicagoan Lovie Ajayi-Jones. Welcome to Chicago Tonight Black Voices. Thanks for joining us. We're glad you're here.
Thank you for having me.
So you've been, talking about being a professional troublemaker. You mentioned it in that 2017 TED Talk, which has been viewed a lot. But your first book was I'm Judging You, the Do Better Manual. Why now for the Professional Troublemaker book?
Yes, my book, Professional Troublemaker, is a fear fighter manual. And I think right now it's really urgent because we are living in a world that is scarier than ever, I think. And I think right now what we need are more people to be professional troublemakers. And what that means is they're disruptors for good. So they're the people who are in the meeting who say, family member who points out the bad joke your uncle makes, they're the friend who's telling you, let's have a tough conversation. I think professional troublemakers are the people who are elevating every room that they're in, and we need them to exist. So I want to affirm them. And if you are not one, I want to convince you to become one.
It's a tough sell. So you're inspired a lot by the head professional troublemaker in your life, your grandmother. Tell us about her and why she inspires you.
Yes, my grandmother, for me, was the person who I looked at, who gave me permission to be a bold woman. She took up space without apology. She allowed herself to be celebrated. My grandmother was kind, but she didn't take any of your stuff, okay? And she was so deeply loved. And what I didn't realize I was doing was watching how she was moving through the world and learning that I could also do the same thing and be this person. So yeah, this book is dedicated to Mama Faloyin, who passed 10 years ago. So this is actually an amazing tribute for her.
You immigrated from Nigeria with your family at a young age, at 9, and you write about how that was something to overcome for you. But in what ways was, overcoming that also your superpower?
Yeah, coming from Nigeria to the United States, it was the first time I was a new girl anywhere. I was different for the first time. My name was different. The way I sounded was different. But I adapted as kids do, and you don't want to be different at 9. But I think when I got to college and at the University of Illinois, and I got to see everybody kind of own their culture in a real way, I was like, there's no reason for me not to own my Nigerianness. And I think my Nigerianness is one of my superpowers because it informs how I write, how I speak, how I approach the world. We're a very bravado-filled people. And I think oftentimes the thing that makes us feel that we are too much or that we're too different is a thing we have to double down on because it's something that is a competitive advantage.
In the book, you write about the oriki, and I hope I'm saying it correctly. I'm from Mississippi.
You are.
Thank you. Good. Tell us what that is and why you need one.
So an oriki is from traditional Yoruba land. I'm a Yoruba girl from Nigeria. And it is something that ties you to your lineage and your family, and it kind of affirms your very being. I call it a standing ovation for your spirit. And it is something that I think everybody needs because we are in this world being told all the time that we're not enough or that we're too something or that we need to change something that's core to ourselves. And an oriki is exact opposite. It's saying that you are amazing just as you are today. Do you know who you are? Like, can't nobody touch you. Can't nobody say nothing to you. Can't nobody say nothing about you. So I think it's important for us all to write ourselves orikis.
So fun exercise. How does one do this? This is sort of an exercise that you give readers of the book, and you wrote your own, and you liken it to, if Game of Thrones fans will know the one that is often given to Daenerys Targaryen. I'm vamping while you find your page, but go on.
Yeah, when you think of how they used to introduce Daenerys, every single time you heard her introduced, you felt hyped on her behalf. Queen of the Andals, Mother of Dragons. She was a protector of the 7 realms. And I think all of us need to have it. And I created one for myself. And mine is Lovey of House Jones, first of her name, Assassin of the Alphabet, bestseller of books, Conqueror of Copy, Dame of Diction. That's like half of what I wrote. But I want everybody to write one for themselves. I think you need to have it in these moments when somebody tells you something that makes you feel diminished, or a bad day that you had, or when you want to do something big like ask for a promotion. Read that thing and let it gas you up.
All right. So why troublemaking, I guess? You talked about this a little bit, but how is the advice that you're giving folks, how is it troublesome?
See, I think trouble is actually a good thing. Think about the late, great John Lewis, who said, we need to be ready to make necessary good trouble. Usually trouble is anything that's disrupting what's happening in the room. And what's happening in the room is often not okay. So if it means making good trouble, it means telling the truth. It means asking for somebody's voice to be heard when it was previously not. It means using your power in service of other people. And I think making trouble is a good thing. We need to reclaim the word trouble. In this world that is a dumpster fire, making trouble is a good thing.
So you just wrapped your book tour. I wanted to ask you this before we let you get out of here. There was this sort of kindness train that formed on your book tour. Tell me about that and how it got started.
The kindness train has touched my spirit. When I announced my book tour, a lot of people were like, oh, I can't afford to come. Other people saw comments in my social from people who couldn't afford to come and said, oh, I'll buy you a ticket. I'll buy you another ticket. Through there, over 1,000 comments 500 people who said they couldn't afford tickets, 500 other people bought their tickets. And then my friends picked up the mantle and said, I'd buy 100 tickets. We ended up giving away over 1,900 tickets, which meant 1,900 books in my book tour. And it went to frontline workers, moms who need a break, social workers, anybody who just could not come. And for me, I think that's one of the best things that have come out of this whole book tour, this whole book launch, is that people really showed up for each other and showed that community is a verb.
Paying it forward. Our thanks to Lovey Ajayi-Jones for joining us. It's a pleasure to have you.
Thank you for having me.
Again, the book is called Professional Troublemaker, the Fear Fighter Manual. For more on how to fight your fears and write your own Ariki, you can visit our website. Back to wrap things up right after this.
Don't ever miss Chicago Tonight. Subscribe to our podcast. Get a daily download of our show delivered to your desktop or mobile device. Go to WTTW.com/Chicago Tonight Podcast and subscribe.
And that's our show for this Wednesday night. Please join us tomorrow night live at 7. We'll be live from Wrigley Field as the Friendly Confines reopens to fans for the first time since 2019. And a new documentary from Ken Burns gives us an inside look into Ernest Hemingway. Now for all of us here at Chicago Tonight, I'm Paris Schutz. Thank you for watching. Stay healthy and safe, and good night.
Closed captioning for this program is brought to you by Robert A. Clifford and Clifford Law Offices, dedicated to preserving the dignity and rights of all individuals.